Welcome to the R-Series ECG monitoring module. You can use the R-Series for both short-term and long-term ECG monitoring. In this module, you will be introduced to the three methods you can use to monitor ECG rhythms, and you will also learn how to display three ECG lead traces. Before you begin, verify that the R-Series defibrillator is ready for use by noting the green check mark on the defibrillator face. If a red X is present, one person should attempt to deliver therapy using the defibrillator, while another person runs to get a defibrillator with a green check. You can monitor a patient's ECG by using a 3-lead or 5-lead ECG patient cable, hands-free therapy electrodes, or standard defibrillation paddles. In this module, we will focus on using a separate 3-lead or 5-lead ECG patient cable. To learn more about how to prepare the patient's skin and how to place ECG electrodes on a patient, review the Prepare Patient module. It is important to remember that once you have prepared the patient's skin, snap the lead wires onto the electrodes before applying them to the patient. Select each item to learn more about the ECG cable attachment options that can be used to monitor the ECG with the R-Series. Unplug the ECG end of the one-step cable, leaving the resuscitation electrodes connected to it. Plug a 3-lead or 5-lead ECG cable into the ECG connector at the back of the defibrillator. Once you have the cable plugged into the R-Series, you can begin monitoring your patient. To do this, follow these steps. Turn the unit on. Press the manual mode soft key, and then the confirm soft key if required. Press the lead button until the desired lead is displayed in the upper right-hand side of the monitor. Press the size button to change the size of the ECG display. If, while monitoring your patient, you see a broken line on the defibrillator display screen, it is an indication that the electrodes are not in good contact with your patient's skin. Reapply the electrodes and check the connections between the electrodes and their cables. You will hear a beep that will sound with each heartbeat. You can turn the heart rate beeper off at any time. Press the Option soft key, and then press the QRS Vol Off soft key. Press the QRS Vol On soft key to turn the heart rate beeper back on. The R-Series can display three ECG lead traces with the use of a 5-lead cable in monitoring mode. Press the Option soft key. Press the Traces soft key, and then press the 3 leads soft key. Press the lead button to change the views. Hands-free manual defibrillation allows resuscitation teams to identify shockable rhythms, manually charge the defibrillator, and manually deliver shocks using hands-free therapy electrodes. To begin hands-free manual defibrillation, turn the mode selector to On. Press the manual mode soft key, and then the confirm soft key if required. The front panel will light up. Check the display monitor and verify the presence of a shockable rhythm. If you are using the R-Series with see-through CPR, continue compressions and verify suspected rhythm using the filtered ECG waveform on the monitor. If desired, ALS providers can change the default energy setting by pressing the Energy Select button up or down. Press the Charge button. When the shock button is illuminated, stop compressions and confirm shockable rhythm. Then press Shock. Begin compressions immediately after you have delivered the shock. After 2 minutes of compressions, observe the rhythm and, if needed, shock the patient again. Repeat this sequence until the end of the resuscitation event.
One of the most important reasons to use EtCO2 monitoring is to verify that the endotracheal tube placement is correct and that the ET tube is not in the esophagus. Other critical reasons are that the airway must be continually monitored after intubation to ensure that the ET tube has not moved, as well as monitoring to assess the effectiveness of CPR. To begin EtCO2 monitoring, plug the EtCO2 cable into the back of the R series in the yellow port marked CO2.
Turn the R Series Plus to On and select Manual Mode or Pace Mode.
Press the Param soft key. Then press the CO2 soft key. Then press the Enable EtCO2 soft key. The message CO2 Warm-Up will be displayed. This will take approximately 60 seconds. The first time the EtCO2 sensor is plugged into the R series, the unit will need to be zeroed. Place the ET tube adapter into the sensor. Do not connect to the patient. Ensure that the sensor is away from carbon dioxide sources. Press the Param soft key. Then press the CO2 soft key. Then press the Enable EtCO2 soft key. Press the Zero soft key. The message Zeroing CO2 Adapter will flash. Once the zeroing process is complete, connect the adapter to the patient's ET tube or capnomask.
Welcome to the R Series Synchronized Cardioversion module. Certain arrhythmias, such as ventricular tachycardia, atrial fibrillation, and atrial flutter, require synchronizing the defibrillation discharge with the ECG R wave to avoid the induction of ventricular fibrillation. In this case, a synchronization circuit within the defibrillator detects the patient's R waves. When you shock the patient, the device discharges with the next detected R wave, thus avoiding the vulnerable T wave segment of the cardiac cycle. In this module, you will learn how to properly place pro pads on a patient, how to verify the device is in sync mode, how to set the proper energy setting, how to ensure a safe environment when performing defibrillation, and how to use the R series to deliver a series of synchronized defibrillation shocks. It is important to note that only skilled personnel trained in cardioversion procedures should perform synchronized cardioversion. Before you begin, verify that the R series defibrillator is ready for use by noting the green check mark on the defibrillator front panel. If a red X is present, one person should attempt to deliver therapy using the defibrillator, while another person runs to get a defibrillator with a green check. When performing synchronized cardioversion, separate 3-lead ECG electrodes are also recommended in addition to defib pads. To ensure good electrode-to-skin interface, it is important that you properly prepare the patient's skin. To learn about how to prepare the patient and how to place electrodes, review the Prepare Patient module. When using the R Series Plus to perform synchronized cardioversion, you must first set the defibrillator to On, press the Manual Mode soft key, and then the Confirm soft key if required. You must verify the device is in sync mode. To do this, follow these steps. Press the Sync On-Off soft key. Software versions prior to 12.00 will have white letters and a black background. Software versions 12.00 and higher will have black letters and a white background for better visibility. Verify that the display shows the word sync. If the display does not show sync before the jewel selected, press the Sync On/Off soft key again. Once in sync mode, the device displays markers, the down arrows, above the ECG trace. These markers indicate points in the cardiac cycle where discharge can occur. Verify that the markers are clearly visible on the monitor and that they are over the R wave, and that their location is appropriate and consistent from beat to beat. If necessary, use the lead and size buttons to establish settings that yield the best display. Next, you must select an energy setting. The recommended energy settings for Zoll rectilinear biphasic waveform for cardioversion of atrial fibrillation are 75 joules, 120 joules, 150 joules, and 200 joules. For more information on biphasic energy levels, review the ACLS defibrillation protocols document. Cardioversion of atrial flutter is frequently successful with lower joule settings. To set the energy and charge the device, follow these steps. Press the Energy Select button up or down as necessary. Press Charge. Before shocking the patient, ensure the environment is safe for defibrillation. To do this, remove high concentrations of oxygen from the patient. Confirm that no one is touching the patient. Loudly warn all persons to stand clear, and look to make sure all persons are clear of the patient, the bed, and any equipment connected to the patient. You are now ready to shock the patient. When the shock button is illuminated and everyone is clear, press and hold the shock button until the discharge occurs. The defibrillator will automatically go out of the sync mode after you deliver a shock, unless your institution has configured it otherwise. If you need to shock the patient again, repeat the procedure by pressing the Sync On/Off soft key. Increase the energy, and deliver subsequent shocks until cardioversion has been successful. Welcome to the R-Series pacing module. The R-Series defibrillator contains a VVI demand pacemaker, a safe and effective design for non-invasive temporary pacemakers. In this module, you will learn how to verify proper R-wave detection, how to set proper pacing rate and output, how to determine capture electrically and mechanically, and how to set up the R-Series for standby and asynchronous pacing. Before you begin, verify that the R-Series defibrillator is ready for use by noting the green check mark on the defibrillator face. If a red X is present, one person should attempt to deliver therapy, while someone else runs to get a defibrillator with a green check. You can use the R-Series to deliver non-invasive temporary pacing using the one-step pacing or one-step complete resuscitation electrodes, or you can use standard multifunction electrodes and a separate ECG cable. For pacing, one-step pacing or one-step complete electrodes need to be placed in the anterior-posterior position. When you use standard multifunction electrodes, apply them before you apply the ECG electrodes. To use a separate ECG cable, first unplug the ECG end of the one-step cable from the back of the defibrillator and plug in a separate 3-lead ECG cable. Snap the ECG electrodes onto each of the lead wires, then place the electrodes on the patient. Before you begin pacing your patient, you must first verify proper R-wave detection. Convert the R Series Plus to the manual mode. First, turn the mode selector to On. Press the manual mode soft key. Then press Confirm soft key. Then turn the mode selector to Pacer. The Pacer door will drop open to display the knobs. The downward pacing spikes indicate each pacing pulse, and the heart-shaped symbol flashes each time the defibrillator senses an R wave. The lead vector will change depending upon which electrodes you are using for pacing. When the one-step pacing and one-step complete electrodes are used, the R series will display and print the lead labels as P1, P2, and P3. If standard leads are required, you can apply a separate cable with conventional ECG electrodes to view standard leads 1, 2, and 3. Select each method to learn about choosing a lead. For one-step pacing, the ECG signal appears in lead P3. Press the lead button to cycle through the leads, P1, P2, and P3, to choose a lead with good visualization and proper sensing of the R wave. P1, P2, and P3 are non-standard ECG monitoring lead vectors used for one-step pacing. The ECG display may be slightly different than with standard leads. It is important to note that while ECG signals acquired from P1, P2, or P3 are appropriate for ECG rhythm assessment and to determine electrical capture during pacing, they should not be used for diagnostic purposes. Use conventional ECG electrodes and a separate ECG cable for that purpose. When pacing with a separate ECG cable, the ECG signal appears in lead 2. Press the lead button to cycle through the leads, 1, 2, and 3, to choose a lead with good visualization and proper sensing of the R wave. If you are acquiring ECG signals for diagnostic purposes, be sure to use conventional ECG electrodes and a separate ECG cable, and not one-step pacing electrodes. You are now ready to begin pacing. First, set the proper rate. The rate will default to 70 unless your institution has configured it otherwise. To set the pacer rate to 80 beats, turn the rate knob. Observe the downward pacing spikes on the monitor. As you increase the rate, the downward spikes get closer together. As you decrease the rate, they move further apart. Set the pacer rate to be 10 to 20 beats faster than the patient's intrinsic rate and high enough to generate a sufficient cardiac output. Once you set the rate, you can increase the output to achieve capture. The normal range for capture is 40 to 80 milliamps. To get capture, turn the output knob. Usually, when obtaining capture during pacing, you will overshoot the patient's threshold and will need to turn down the output. Decrease the output slowly until you just lose capture, and then slowly increase it until capture is regained. This output is the patient's threshold. Once you have determined the pacing threshold, set the output to 10% above that threshold. It is important that you recognize when pacing stimulation has produced capture. You must assess capture both electrically and mechanically to ensure appropriate circulatory support of your patient. Select each method for more information. You determine electrical capture by viewing a downward pacing spike, followed immediately by a widened QRS and an extended, sometimes enlarged T-wave, occurring at the selected pacing rate. The intrinsic rhythm should be absent. You confirm mechanical capture by physically palpating the femoral or right radial or brachial pulse. Avoid assessing the pulse in the carotid and left radial arteries because muscular contractions from the pacing pulse may cause misinterpretation. At any time during pacing, you can use the 4-to-1 button to determine the patient's underlying rhythm. Press and hold the 4-to-1 button, and 3 of 4 pacer impulses are suppressed. You can visualize the underlying rhythm without losing capture. When a patient is at risk of developing symptomatic bradycardia, you can use the pacer standby mode. To do this, gain capture, then press Recorder to document the appearance of pacing for this patient. Next, turn the rate down to below your patient's heart rate. Because this is a ventricular demand pacer, the pacer will only be active when the patient's heart rate falls below the set rate. Make sure that you have a good ECG signal when using standby pacing. In an emergency when ECG leads are not available or there is too much interference with the ECG waveform, you can switch to asynchronous pacing. You should only use this mode when there is no other alternative. To use this mode, follow these steps. Turn the unit on. Press the manual soft key. Press the confirm soft key. Then turn mode selector to pacer. Press the async pacer on-off soft key. Increase the output until you are able to feel a pulsation at a femoral artery, a right brachial artery, or a right radial artery. The pacer will pace at the set rate independent of the patient's underlying rate. Attach ECG leads as soon as possible and turn off async pacer. Pacing. When the R-series is used with the one-step complete or pacing electrodes, a separate ECG cable is not required because the 3 leads are built into the front electrode pad. If these electrodes are not used, you must first attach an ECG cable to the device and place the 3-lead ECG electrodes on the patient. To begin pacing your patient, turn the dial to pacer. The downward spikes indicate pacing pulses. The rate will default to 70 pulses per minute unless your institution has configured it otherwise. Next, increase the output by turning the dial clockwise. Normal range for capture is between 40 and 80 milliamps. Usually, when obtaining capture, you will overshoot the patient's threshold. If this happens, decrease the output slowly until you just lose capture. The minimum output that obtains capture is the patient's threshold. Once you have determined the pacing threshold, set output to 10% above that. Confirm electrical capture by viewing a downward pacing spike followed immediately by a widened QRS and an extended, sometimes enlarged, T-wave occurring at the selected pacing rate. The intrinsic rhythm should be absent. Mechanical capture can be confirmed by physically palpating a femoral or radial brachial pulse. At any time during pacing, you can use the 4-to-1 button to determine the patient's underlying rhythm. Press and hold the 4-to-1 button. This suppresses 3 of 4 pacer impulses to visualize the underlying rhythm without losing capture.